Dr. Suresh is going to give will definitely be much useful to us. So I welcome you, sir, first to the Parul University. Physically, we have met in 1 or 2 program of Vice Chancellor meeting somewhere in Delhi. But today I am going to hear you in this particular program. You are really the stalwart, and under your leadership, a lot of problems between AICT and PCI has solved, and you have put up so many good things so that our pharmacy education is in the streamline and doing a lot of things. And especially this is Corona time where there is a lot of importance. And as it is said that I am a EC member at the Government of Gujarat in GPCB, every day I am also taking about 8-10 industry. They are going to produce some of the pharmaceutical which can be producing going to be some of the medicine towards the corona. So I'm playing the role of environment engineer now. Every day I'm attending about 5-6 hours to their GPCB. And yes, today you have joined. So I am with you for a few hours. And I hope that whatever you are going to tell will be much useful to you. Again, welcome you to sir. And we will meet again. Thank you.
Thank you so much, sir. I am now happy to introduce Dr. Devanshu Patel, the president of our Parul University. Medical doctor by profession, Dr. Devanshu Patel is MBBS and MD Pharmacology from the renowned Maharaja Sayajirao University of Baroda. Dr. Devanshu Patel is a very dynamic, visionary and proactive leader with an unflinching commitment to the cause of education. Dr. Devanshu Patel strongly believes that there is no dearth of talented individuals, and when these individuals are provided quality education and skill building programs, they could be transformed into dynamic leaders and thinkers of the 21st century. Sir, may I request you to kindly address the seminar?
Thank you, Dr. Abhay. I hope I am audible.
Yes, sir.
Okay. First of all, let me thank Dr. Suresh sir for giving his consent to address the pharmacy professionals of not only Parul University from across the India by way of this seminar. Only in Parul University, we have nearly 1,500 students who are associated with pharmacy education in one way or other, may it be Bachelor of Pharmacy program, PharmD program, Diploma in Pharmacy program, or Masters in Pharmacy program. So this webinar is going to have a huge influence on all these 1,500 students who are going to listen to Dr. Suresh sir. I would say this is a great privilege for all the students, because when I remember when I was in my undergraduate and postgraduate courses, I never had an opportunity to listen the administrator of the profession which I am pursuing. So today is a great opportunity for all the students to listen to the professional who is administering the profession which you have chosen for your life. So a great opportunity to listen to him and to raise your questions and to know how it is to administer at national level such a great profession pharmacy is, because I am also very closely connected with this profession, being a pharmacologist. So I know the nuances of this profession. And as it is very well said very recently, that we may not be having solution to this coronavirus pandemic as of now, but I think you and me are the solutions which we can derive out of our expertises and out of the knowledge which we gain. So how best we can explore our leadership skills will be very well explained by sir in today's webinar. So I request all the students and teachers to take maximum benefit of this program and maximum benefit of his expertise, and let us learn from him, and let us learn to make ourselves more effective leaders so that we can cater better to our society, our profession, and our country. So thank you once again, sir, for accepting this invitation. Thank you, sir.
Thank you so much, sir. It is my proud privilege to introduce Dr. B. Suresh, who has distinguished himself as an eminent educationist, pharmacist, and a visionary leader. Dr. B. Suresh is the Pro-Chancellor of JSS Academy of Higher Education and Research, Mysore, a deemed university since June 2019. Prior to his present post, he was the founding Vice Chancellor of JSS University. Dr. B. Suresh is also the President of Pharmacy Council of India and has the unique honor of being elected 4 times to this leadership position. Dr. B. Suresh nurtured the JSS University to scale great heights in a very short span of time, and the university was ranked among the top 500 universities of the world by the Times Higher Education Ranking 2019, becoming the first deemed university in India to set this record. The JSS University was able to forge several national and international collaborations under his leadership and has been receiving national and international recognitions for the efforts in nurturing interdisciplinary research in medical education. He is also the director of JSS Education Foundation Private Limited, the international arm of JSS institution that has established institutions in Dubai and Mauritius. The leadership provided by Dr. B. Suresh at the Pharmacy Council of India has resulted in bringing about a paradigm shift in pharmacy education and profession. The council had been able to bring out several path-breaking regulations that help in enhancing the standards and quality of pharmacy education and profession in the country. Dr. B. Suresh has pioneered the cause of promoting pharmacy practice concept and has the unique honor of having introduced postgraduate program in pharmacy practice and pharmacy programs in India, and continues to strive to uplift this facet of pharmacy profession by closely working with other global leaders. Dr. Suresh was the chairman of the scientific body of Indian Pharmacopoeia Commission, which is responsible for setting of standards for pharmaceutical substances and formulations. He is also the delegate member of the United States Pharmacopoeia Convention and International Commissioner of Accreditation Council of Pharmacy Education USA. He is also the executive member of the Commonwealth Pharmacists Association, the Scientific Committee on Problems of the Environment, which is a part of the International Council for such as UNESCO and United Nations Environment Programme, has elected Dr. B. Suresh as its executive committee member. Dr. B. Suresh was also the past president of Asian Association of School of Pharmacy and chairman of the education section of the Federation of Asian Pharmaceutical Association. He is the past president of the Indian Pharmaceutical Association and was responsible for drafting the Pharma Vision 2020 that was launched by Dr. APJ Abdul Kalam, the late President of India, in the year 2008. Dr. Suresh has received several national and international publications to his credit and has been invited to numerous national and international platforms as a keynote speaker and deliver orator. He has organized many national and international meetings and conferences in India and elsewhere, and has spearheaded the organizing of World Congress of Pharmaceutical Sciences 2011, the 71st International Congress of International Pharmaceutical Federation. He is actually involved in the education initiatives of FIP and is a member of Pharmacy Education Task Force. Dr. Suresh is a recipient of several national and international awards in recognition of his invaluable services in the field of pharmaceutical education. To mention in particular, the Federation of Asian Pharmaceutical Association, the FAPA Ishide Award in 2004, and Doctor of Science, honoris causa, confirmed by the Tamil Nadu Dr. M.B.R. Medical Institute, Chennai in the year 2007, and by the Rani Durgavati Vishwavidyalaya, Jabalpur, Madhya Pradesh in the year 2012. Dr. B. Suresh is also the recipient of the prestigious Eminent Pharmacist Award of the Indian Pharmaceutical Association, the M.L. Shroff Award of the Indian Hospital Pharmacists Association, and the K.C. Chatterjee Award of the Indian Pharmacy Graduates Association, and the Fellowship of the Commonwealth Pharmacists Association. He continues to provide his leadership role in his multifaceted career by serving on several national and international statutory committees, namely the Drug Technical Advisory Board, National Board of Accreditation, National Committee for Clinical Establishments, and Committee for the Purpose of Control and Supervision of Experiments on Animals. He is fondly liked by all his colleagues for his human nature and approach and his excellent team leadership. It is indeed a very proud moment to have a very dynamic person with enormous knowledge and leadership qualities to enlighten us on the topic, extraordinary times require extraordinary leadership. May I kindly request you, Professor Dr. B. Suresh, sir, to please take over the proceedings.
Thank you very much, Abhay, for introducing me. At the outset, I would like to thank the leadership of the Parul University, the President, Dr. Devanshu Patel, the Vice President, Dr. Devanshu Patel, and the Provost, sir, there. We interacting for some time. I have come there a couple of times to the campus, and it has always been a pleasure to visit your campus and the way in which the whole campus is organized, the events are planned, are all very overwhelming and has been always been memorable to me. And I'm sure the university is growing from strength to strength, and my wishes to all of you at this moment. This has been a sort of a time where you go on giving webinars, and there are hundreds of webinars happening everywhere. Quite often students feel, which one to attend or which one not to attend. Quite often some of them would be repetitive, some of them would be not giving really the solution. So I've sort of become very, very restrictive in trying to go forward and keep continuing to do, which I did a little bit in earlier days of this pandemic. I was going quite often, but of late I said there are many other people doing good work I should not do, but I could not refuse the invitation made by Abhay. He was after me and he said, any day, any time is fine with us. You have to come and make a presentation and do it. So I was thinking at the turn of events that are happening, like, when the pandemic really set in early days of March, what was required was, how do we move on? How do we align ourselves and try to get on with the online education, or to close down the institution for a while, or look care of the health. Lockdown was considered as a vacation. It was all sort of, people felt comfortable. It's going to be over. So this lockdown for 15 days is over. Okay, it came as a unexpected rest or a holiday for all of us. We took it as a enjoyment or fun. Okay, 15 days not work. We sit at home, we watch TV, we with the family. Everybody started advising, do yoga, give quality time to family. This is an opportunity to connect. All these advices were going on, and they said this is nature's gift to you. But when things started progressing a little bit more, then they found that though the lockdown may be over, the challenges are not going to be over. So you have to continue to face those challenges. And globally, countries, nations, and organizations all are now perplexed. How do we move from here? What is the path we have to take to move forward and try to run nations? Just now I saw a video clipping which was sent out by somebody, the president of United States, trying to campaign to his people, mostly about his election in November. He was talking about how people, even if they are going to, they have been announced that you are going to die, you should come and still vote for him and go. I mean, everybody has a perspective of what they consider as important, and they would like to do it. Though he was mentioning it was, he was telling that in a lighter vein. But the question is, this is going to be there for us. Everybody knows that this is going to be there for some time, and we may have to realign or rearrange or change our the way of life. What people are keeping talking, this may be a new normal. People are talking about that. Now that all is fine. You can wear your mask and go to work. You can go with your social distancing. You can keep sanitizing. Maybe this will become your new way of life. Fine, perfectly fine with that. But what about other things beyond that? The organizations have to run. The productivity in the country has to continue to be there. The education has to continue the way which has to move on further. The students have to continue to learn and graduate and find jobs. This all has to go on, right? We cannot stop it just like we used to do earlier. Okay, let's wait for a week, 10 days to be over, and let's get back to track, and we'll conduct special classes, and we done with that, and we can conduct the exams still. Now, how much special classes are we going to conduct? So these are all the challenges which are there. So that's why I call these are all extraordinary times ahead for us. And for extraordinary times, there is a need for an extraordinary leadership. So that is why, more than talking about pharmacy, though I am going to show you examples of pharmacy, but basically they will be about leadership. I'm going to talk to you not of thing. I'm just going to show you real live case studies here. that what extraordinary leadership is all about. And if that is the type of leadership which is going to be available to us, then yes, our nation, our organization, and our own way, even as a person individually in a family, you have to show extraordinary leadership to your family. You cannot go back to your family and say, oh, I don't have a job, I don't have this, I don't have that. Now what do we do? Let us also. You have to show, even if you don't have anything, you have to project now how you will be able to still manage in spite of the pandemic. That means from an ordinary human being, you have to become an extraordinary human being in your house and give that positivity to people around you, so that they know that they should not feel desperate or feel despair about themselves. So this is very, very important in this moment because of two reasons. One, we do not know what the definite new normal future is going to be there. Nobody can give a date to you. Okay, this day the pandemic will be over and we can move on with life in this particular manner. Nobody can say. Nobody can say again, this day the drug will be available to you. These are all wishful thinking. Okay, it will be ready by August, it will be ready by November, ready by next year. We all wishful thinking and we are having hope. Nothing wrong in that. We'll continue to have that hope and wishful thinking and move on. But nobody can definitely say this day the product is going to be out and after that we don't have to worry. And in this environment, what really requires is that we are able to turn around the tables, take it by the, as I said, take the bull by the horns and try to move forward in our life and see how do we move forward. What are the things that we can bring about a change? And this is what I am going to talk to you about the leadership, because everyone, even in your university, I can see on the panel here the full leadership, the vice president, the provost, the vice chancellors, the head of the department, deans, you all are there as a leadership there, because you all want to lead your students, lead your teachers, lead your fraternity, lead your community, and tell them, don't worry, things will be fine, and we are there to take care of you. So this confidence is required for people to move on, that there are people who are there to take care of you. There are people who are thinking for you, and hence the need for worrying about you is not required. Only thing is continue to act as we may tell you, continue to perform as we may tell you, so that we are able to take you to the next level. So this is what the whole crux is. So I'll just try to take you through some few slides. I have not made many slides, but I'm sure each slide has a story for you to understand. And that story, I hope will help you all to emerge as leaders your own way. It may be students themselves who are listening. They may emerge as leaders among the students community themselves. How we'll hold each other's hand. Teachers may be there listening to this talk. So they will hold each other's hand and try to see how do we emerge as leaders and provide that extraordinary leadership. There may be deans who may be seeing it. So they may try to evolve and try to say, how do we provide this leadership? And move forward in that direction, so where we can move and progress in our country's needs. Now I will try to share the slide with you all, which I am going to present, and just one of you can confirm whether you have been able to see my screen once it is there. You are able to see my screen now?
Yes, sir.
Yes, sir.
The first slide is visible. The title with the extraordinary times require extraordinary leadership with the mountain view.
Yes, sir. Yes, sir.
Okay.
Yes.
So now I am having seen that the slide is visible to you all. So I will just go through the presentation, and so that is why I thought, no, let me not talk about just pharmacy alone here, though the underlying flavor is going to be pharmacy, but it is not just about how pharmacy education should move forward or how industry should respond. It's just going to be more of leaders who are going to be there, that's going to matter. How the leadership which is going to be there is going to matter. And let me take you through this presentation. Now, before we look at extraordinary leadership, I think it's important for us to understand what is leadership in itself. Leadership is the art of motivating a group of people to act towards achieving a common goal. I think this is a very simple philosophy. That is, you motivate a group of people who believe in you towards a common goal. Here you can see a herd of elephants. There is a leader in front. The whole herd is moving because they feel that the leader is going to take them towards a common goal, maybe a watering place or a migration to another place of vegetation, or whatever be the different purposes which is there. The leadership is able to convince the whole herd of elephants that you come along and we will go to the destination which they are moving forward about. I think it's a typical simple example of leadership, that people believe in you, both based on your experience, your knowledge, your education, your skills, that you are going to lead them to the destination which they are looking at, the common goal of moving forward. This is leadership. Now, what is extraordinary leadership? How is it different from the leadership? Is something which is very important for us. Now, if you look at extraordinary leadership, it is putting risk in context with one's abilities. Now, how much of a risk a leader is ready to take? What is his ability? How much risk he can take to take the institution forward, or the country forward, or the organization forward? So this is something which we have to understand. How much of risk is one person able to going to put forward? And he also knows what is his boundary of competence, because suddenly he cannot say that I am going to evolve into discovering a new drug when you are not at all having an experience even in setting up a laboratory. So I think that one should know what is his competence of boundaries which he has to he can rely on, and he is also masterfully exploiting them to accomplish more than anyone else, because it is very important. Extraordinary leadership requires, you use all your competency, your abilities, and use them properly to achieve that. That means people will expect, oh, how this organization is going to manage. Let us wait and watch. So you should be able to move beyond that. Right now, let us say we are facing at Mysore in our own hospital. We have a 1,800 bed hospital which we are having. Now, in this 1,800 bed hospital, now the Mysore is going to catch up with the coronavirus increase. Every day it is happening. Even in our hospital, we are having about now 75 plus patients admitted, and we are caring for them. And the district administration has been putting forward on the healthcare community across the Mysore district that they all have to give 50% of the beds to the corona patients who may come there. It's a direction, it's an order. Now, how many of them will really be able to do it? How many of them are going to be prepared for it? What type of planning has gone behind that to meet such a possibility? Now, let us say if I am looking at managing 500 to 600 corona patients in my hospital, what will be the impact on my own health community which is there? What will be the impact on the doctors? What will be the impact on the healthcare professionals and nursing staff and administrators there? Are they going to have the confidence to move forward? What type of safety they need? What type of protection I should give? What type of reassurance should be available to them that, no, don't worry, we are there with you. Let us serve the community. And it also means losing money, because when the patients come to you for corona treatment, the other patients will not come to the hospital. So obviously you are losing this. So you should know what limitations, what boundaries you can move forward. Now, if extraordinary leadership has to be provided, I think it is then possible. Now, what you are seeing in the picture here is a pack of lions. They are there. And they are walking confidently in the middle of the road. And all the cars are waiting behind. How do they get that confidence? How did the lions have the confidence? Because they know that they are a threat to the other people rather than the cars being a threat to them. They know that their leadership and their power and prowess is going to be sort of, something which people will look at awe. They know that the people will not risk to come out and try to chase them away off the road. And they have the confidence, and they know as a pack, they all are equally very strong, and they are moving forward with such great confidence and stride in the middle. I think this is what all extraordinary leadership is about. That means you should know what you can do. You should have the confidence that you can deliver it, and you know that people will respect you because of your knowledge, your expertise, your skills, and at the same time, the pack is believing in each other. The team should believe in you that yes, there is something in us special with our leader. We should be able to move forward and achieve the goals that is set before us. I think this is something which I see from this picture, and I'm sure you also would be able to realize the same. Now, having told this, this symbolically what leadership or extraordinary leadership is about, now let us really look at what are the qualities that are important for extraordinary leadership to be there. And when I talk of qualities, I'm not going to give you number 1, 2, 3, 4 and go on talking. You should become like this. You should become like that. But what I am going to tell is real people, how they have shown this extraordinary leadership and what did they success. And I am not going to talk about people who are in the past. I am going to talk to you people who are in the present, who are doing really their leadership. You are going to see them and you know them, who are these people, and perhaps then you will connect, and each one of you can become first a leader and then try to become an extraordinary leader to lead this country, lead this profession, and carry out the responsibilities that is required for you. Now, when we look at this extraordinary leadership in extraordinary times, certain qualities are there. So these qualities, I have listed it, they are 10 in number. So that means that I am going to share with you 10 more slides only, which talk of only about the extraordinary qualities which you should have to be an extraordinary leader. Here you can see an image, the head of one of the largest democracy in the country, and one of the strongest democracy in the world, one of the largest democracy in the world and the strongest democracy in the world are hugging each other and trying to understand and appreciate each other's strength, that they have together be able to achieve a better objective than being individually trying to tell I am a great leader. So now you can see even just one act of the Indian and the Prime Minister's decision that, you know, okay, hydroxychloroquine would be available to United States in the quantities they want. I think it brought an extraordinary response from the President of the United States, the strongest democracy in the world, telling that thank you, India, and the Indian people for the decision on HCQ. A country and a president is saying thank you to India for this extraordinary gesture. This will not be forgotten. Thank you, Prime Minister Narendra Modi, for the strong leadership in helping not just India, but the humanity in this fight. This is about extraordinary leadership. That means on one side, you are trying to provide the world what they want, and the other side, the leader also recognizes that the other country, other leader has acted responsibly and has been able to move forward and not cut corners trying to show that I am better or I am superior. It's a question of gesture at the right time that makes a difference. So this is something which you should understand. And the qualities that are very important are that these leaders should have highly impactful practices, inspire a shared vision, enable others to act, clarity of thought, promote sense of security, ask powerful questions, listen, act confidently, and be disciplined and team first. So these are the 10 qualities which people should have. So now I am not going to give any more. I am just going to show you only the case studies further. Now, first we will talk about the first case study. Highly impactful practice. What do you mean by a highly impactful practice? That means whatever you do, you consider first country first, world first, humanity first. You are not going to talk about your own self first, that I would like to have a promotion or I would like to make my company bigger. I want to rank as #1 company in the world. You are not talking of that. You are talking here that how you want to serve the country, serve the world. So this is something which is very important, and this statement made by Adar Poonawalla, who is the youngest CEO of the Serum Institute of India, which you know already is in the race for the development of a COVID vaccine along with the Oxford University. He said in a statement that 50% of the vaccines that will be manufactured by his firm will be supplied to India. That means he is trying to tell that he is manufacturing medicines not to claim that I was the first in India. He is not claiming that I'll make a profit for my shareholders. He is not telling I'm going to make more money, but he is telling that he is manufacturing it and make it available 50% to the people of India. And then he says, rest I will give to the other countries. He is first reassuring his own country that don't worry, whatever I manufacture, I am not going to sell it for the purpose of profit to another country, another world, and try to make money out of it. But I make sure that our country gets benefits first. I think this is a very, very impactful practice which he is talking about. And this itself will build the image of the organization, build the image of his personality, without saying all the words he is able to achieve. And he made one more statement that these vaccines will be purchased by governments and the people will receive them free of cost through immunization programs. So that means he has already got a plan in place with the government or whichever is the sources that people need not worry about what would be the cost of medicine. He says whatever be the cost of medicine, the governments are going to buy it, and people may receive them free of cost or through insurance or through NHS, whatever the different schemes may be available, but it will be available to them. Hence, the cost is not a material. So this is something I consider as a highly impactful practice. You may have a similar situation in your organization as a student, as a teacher, as a principal. Now, what type of impactful practice you can try to convince the students or convince the teachers or convince the management to achieve is something you will have to realize. Now, one of the simple examples which I can talk to as a teacher community or a dean is like, what can be your highly impactful practices? Now, every student is reaching to you and telling, when will be my exam? When will I graduate? Why don't you cancel the examination? Why don't you postpone the examination? These are all the questions keep coming to you. Now, what can be an impactful practice to the students? You have to give them reassurance. Don't worry about examinations. Let us go on with the learning process. Don't worry, we are there to support you. Whenever the exams happen, we will be there to support you. You will try to help you to graduate in time. I think this is something as an impactful practice which can be done. Let us say if it is regarding the principal or the dean, he should be able to convince the teachers, like, don't worry about anything. Right now, let's move on. There is a challenging time for the management, challenging time for us. So let's go, let's try to do something which is required by or expected by us, and how do we achieve forward from them. And for the managements, I would like to put it like, you may be also going through a lot of other challenges and crunches, but what you have to do is give an impactful way of talking to the faculty and deans and tell, don't worry, there are challenges, but we will be there with you. Don't worry about your compensation or other things. These are only moving times. We'll try to retain and we'll try to see how best we can help you. I think these are the impactful practices which are required to be learned and move forward. Second is you should inspire a shared vision. So I think this is very, very important for an extraordinary leader. Now, this other person you know very well, Krishna Ella, he is again what you call as a very, very successful entrepreneur, successful industrialist. He is now the talk of the town because he is looking at bringing out the first indigenous Indian vaccine. I mean, there are other vaccines which are being developed with the other parts of the world in collaboration, and maybe we may end up manufacturing. But what he is talking of is first vaccine to be developed by India. He feels again the pride of India that, we should also be able to have our vaccine. We should not be holding, looking with folded hands to some other country or some other organization to look at how do we get this vaccine and start writing mails and or sending out communications trying to get this. So he said, let me move forward. Let us see what we can best to do that. So what he did, he has taken the biggest risk of his career. That means if the Covaxin, which he is talking about, is the indigenous vaccine, assuming, God forbid, it does not turn out to be what it has to be, he has risked his whole organization, his company, his reputation, which already is very high. So he's willing to take. So that's what I told about when I talked about extraordinary leadership, the risk-taking ability. So he is ready to take that risk and see how we can move forward. And he has a very ambitious plan. So he is moving with ICMR. He is trying to do it. There are challenges. People are asking, how will you achieve? But that's not the issue. But he shared his vision with his team, with his colleagues, and they all are looking at it in a very, very positive way and looking at great expectation from him. Even his company's slogan says, at Bharat Biotech, we do not see ourselves combating competitors. So they are not looking at they should become better than the other pharmaceutical company. They are telling we are combating against region-specific neglected diseases. So his focus on combating disease, not on combating another competitor in the thing. I think this is a vision, and he inspires with his vision and tries to take the country forward. I think this is something again for us. When we talk of our own roles to be played, we have to have a shared vision which we can share among the our colleagues and the students, and try to tell them that the country or the nation is going to progress. This is only a temporary path, and we should be able to achieve this. Our institution will come up as usual. We'll continue to maintain the quality. We'll continue to get your placements. I think these are the things which a vision which is required from the institutions to be shared to the students. Now, if you look at the study case study 3, it says that enable others to act. So you may have a very powerful position. You may be able to do so many things yourself. But with that power, if you do not allow others to act, then whatever power you are having becomes waste. It may be an organization, it can be in an institution, it can be in a particular government structure. But the whole idea is that we should enable other people to act. Now here I have just taken an example of the Indian Drug Control Department, that is the CDSCO, Central Drugs Control Organization. Now CDSCO, in spite of whatever people may have their own views, has shown very extraordinary leadership again here. How they have shown? They have acted promptly, try to see that how they can help and stimulate the pharmaceutical industry's expectations, that they can able to take it further and take it further in helping the country to develop new drugs or new vaccines, or make available even the regular drugs in the thing. That means remove the spokes from the whole regulatory process. They could have otherwise tried to create a lot of conditions, and they could have made a lot of conditions and a lot of ways of creating problem for people rather than helping. No, the CDSCO was very proactive, very supportive, and was very prompt in its decisions. Like, you know, they gave permission to, for example, to market authorization for remdesivir quickly, and it was accelerated to reach quickly the people. They gave license for manufacture of favipiravir, and they gave license for the itolizumab map to be available. So the idea is that if there is something which is required, and if it is has the right scientific input and background and has got the right support, the CDSCO gave the necessary action to the support to the organization which wanted to do it. So it is enabling the companies or the organizations to work. I think the same applies to the Pharmacy Council of India. Okay, now we are, as a Pharmacy Council of India, as a regulator. Now, as a regulator, in this time of pandemic, we could have created so many other challenges for the institutions which are already struggling to cope up. But the Pharmacy Council of India became proactive. It said even before any other statutory body could come forward to give a guidance. Way back in March itself, we gave a guidance regarding examinations, academic programs, the internships. There was one clear guidance that was issued that solved and reassured the whole education community that they need not worry about the education and the examinations, because they knew PCI would take the necessary proactive support. I think this was very, very important. And what we did in the process, we enabled the universities, we enabled institutions to act. We did not tell them, you write to us, we'll give approval, and then only you should start this activity. You said you want to send for internship to another place. Yes, go ahead. The institution and the university can make arrangement and move forward. You want to conduct examination in a particular way, okay, as long as you all agree and you move forward, it is fine. So we enable the universities, we enable the institutions to move forward in delivering the education. We did not try to be a burden there and write a question, as per regulation, you are not supposed to do this, how did you do this, or why did you do this? So I think this is something very important, that is enable others to act, and this is extraordinary leadership. Case study 4 is for you is to have a clarity of thought that leadership. Now, for example, leadership is not always about money. When we talk of people, we can say, oh, he made this company from 400 crores to 800 crores, or they made this institution which was running like this, from this rank to that rank. It is not about numbers. If numbers are okay, it's good for benchmarking and trying to set goals, but they are not numbers. Extraordinary leadership is about clarity, that what you want to be, what is most important for you. Now, for example, the clarity of thought for Zydus Lila, which is a public listed company, for them the primary duty is to take care of their shareholders and see that their shareholders are making profit, not necessarily worry about the humanity. But the leadership, extraordinary leadership, was very clear in thought. They said this is time not to make money. It is question of reaching out to the humanity and helping them. They said that the hydroxychloroquine tablet will be even lesser than the market or regulated price of the government. I think this is something very clear. He made a message very clear that it is not about making money. It is the question of making available the medicine and making available the medicine to all the people in the world. That is how, with this assurance, the Prime Minister of the country could assure the United States, yes, the hydroxychloroquine will be available to you. And this is how the company has responded. I think, again, it is a very clear thought that we have to do. Country is first, people is first, humanity is first. So money is not the criteria here. So I think you should have clarity of thought. I can go on giving the same example for the Pharmacy Council also, but I do not want to be simply talking about the PCI or talking about ourselves that we did this or that. But I'm just trying to tell this extraordinary leadership you may see in several places happening around you. It may be a simple police officer who may be in your district who is providing an extraordinary leadership in being nice to the people. It may be an ordinary health worker who is around you, who doesn't mind his falling sick or his family being affected. He tries to provide extraordinary leadership there with a clear thought in his mind that, okay, I have to serve the people. This is my objective. I'm not worried about other things. He may be not even getting the salary which he is expected to get, but he feels that is an important time now to serve the country, and he is doing it. This clarity of thought is very important. The next is such extraordinary leaders promote a sense of security. This is the case study 5. Now, how does the people of our country feel comfortable? Like this question was asked in one of the debates which I had a few days back. The question came up in the debate was that the medicine, it was actually a global platform where the what you call as UNESCO was debating with all the leaders from Southeast Asian region and Pacific, talking about access to medicines. And they brought this issue up in that platform and told me, we understand that there is shortage of medicines in India. I said, tell me, where is the shortage of medicines? There is no shortage of medicine. There may be a sort of feeling that there may be a shortage of medicine, but the medicines are available. It is accessible to people. Even during the time of lockdown, the medicine shops were open and made sure that the medicines become available to the people. There may be one or two stray incidences that may be because of lack of communication rather than any other purpose. So what did our country do? Like, what did the pharmaceutical industry do to create this program, to promote this sense of security? The Indian Pharmaceutical Alliance is a group of 25 major domestic firms. It includes Dr. Reddy, Zydus Cadila, you name all the big Sun Pharma, all the big companies are members of this alliance. They manufacture 57% of the Indian drug market. What did they do? They said that we will ensure that the patients in India and the world will continue to have medicines, because there was a mindset in the people that the API come from China, So now China, the material will not come. So the medicines will not be available in India. The prices of medicines will go up. So this type of image was there, and fear was there. The whole idea at that time became was create a sense of security among the people. So the Indian Pharmaceutical Alliance came out with this statement that don't worry, we'll make sure that the patients in India and the world will continue to have access to medicines. Incidentally, Dr. Satish Reddy is the chairman of the president of the Indian Pharmaceutical Alliance, and he has been very proactively working with the government of India to make sure that the pharma industry is able to meet the challenges and continue to provide the medications that are required in the thing. So again, this is an example. Now let us say, if it is in your institutional setting, how will you promote the sense of security among the students? You tell them, don't worry, whenever you come back to our campus, we'll make sure that it is safe for your coming back to the campus. Don't worry about your examinations. We are there. We'll take up the issue about the same thing in the university. And we can go on giving examples like this. I think it is very important when you want to give extraordinary leadership. You should give first a feeling of security to the people around you, the people who are dependent on you. Like even if you go back as a man to the family and a man or a woman to the family and say, don't worry, I will be able to take care of this 3 months or 4 months of pandemic or even 1 year. I'd be able to cope up. Don't worry about other things. I'm there to support you all. So this gives a feeling of reassurance to the whole family to move forward. Now, next is ask powerful questions. This is the sixth quality which such extraordinary leaders have. Now, question is like, unless you don't question, people take it for granted. Okay, he is there, he will do forward. Or people have their own way of looking things in their own perspective. So it is very important to keep asking powerful questions. Now, you can keep asking yourself, how aligned is my organization, both internally, externally, right now? If you are an educationist, you are a teacher, okay, how is your institution functioning now? What will happen after this pandemic? Whether the institution will be able to take off. So if there's going to be challenges, how do I make it? If my admissions are going to be affected, how do I am going to make it? How the teachers will be coming back and trying to do involved in the engage themselves in their teaching and other responsibilities. How can we generate additionally some revenues in the form of consultancy or research or other things? What are the other resources I can rely on? So these are the thoughts which you should keep asking as an extraordinary leader if you are in the organizational setting. Is it going to affect the way the institution is presently operating? Now, for example, even if the colleges reopen back, if the students have to be handled in a particular way in the campus setting, that is, the classroom should have less number of students, the laboratory should have less number of students, but teaching should go on. So how are you going to manage it? Are you going to bring online education and blend it with the regular education? Are you going to have more teachers to manage the time schedule? Are you going to bring the students in 2 batches, one in the morning batch and in the evening batch, so that there is no crowding? I think these are some things which, as an institution, I'm just giving you as an example of institution, how it is going to affect the way you are performing. Suppose if you have to run it in 2 shifts, then you have to look at which staff should come up in the early in the morning and go back, which staff would work late, and how do we manage that? So these things are something which you have to keep asking the questions. What support do your employees need during this outbreak? Now, there may be so many things, even reaching out to your faculty and talking to them how you are doing. Like there may be a faculty who may be affected by the corona infection, or their neighbor might have been infected and he may be worried. So it is very important to ask them, or there may be some calamity in their family, maybe a death, maybe a illness, whether they need support. How do you reach out to them and try to talk to them and support them during this period? I think this is very, very important. If it is not there, what structure you can maintain? Are you connected with your staff? Are you connected with your dean? Are you connected with the leadership above? How are you going to do it? And lastly, you will have to look at is how does our organization need to evolve? As I mentioned in the first point, you'll have to start thinking, okay, now we get back to normalcy in August or September. what are the things I can keep doing to move forward. I think this is something is again sort of extraordinarily planning even before the starting of the organization's functioning is very, very important. Now, this is again a small news which came. I just showing that to you as a cut here, as a screenshot here. There are pay cuts and layoffs. Some of the companies try to shield staff, telling the COVID staff. They said, "Don't worry, we are not going to lay off. We are there to take care of you." And I think this is something very important for us to understand and move forward. That it is very important. I mean, sending a staff home during this period is the easiest thing for any management. But you are going to lose the credibility of the organization. Nobody will believe in you. Then even the staff, when he comes back, first he is going to talk to you. What are you going to offer because you may throw me out anytime. So why should I be loyal to you? So these type of issues comes back. So it's very important at this time for the managements to build trust among the faculty that, okay, we are going through difficult times. I will support you now. I look forward to your helping me back when we start off. We'll work together. We'll try to see how we can benefit mutually, and let's do things properly and take forward. Because without the faculty, the institutions cannot survive. Without the students, the faculty will not be there. So these are all interlinked. So I think there's something for us to understand that as an institution, if we are not going to take care of our people, I don't think we are ready, prepared for moving forward. I think these are the questions which extraordinarily leaders keep questioning themselves and keep preparing answers for them. The only way to support your employees while ensuring them long-term success of your organization is to balance deep with empathy and economic realities. So you cannot say that, no, you do keep doing the thing. I don't have money, so I am not going to pay you the salary. So I think that is not going to help anybody, because he or she also will have to take care of his family. The same is true in case of students who would like to pay fees to the institution. Their parents may be laid off. So it is important to find out whether the parent is laid off and so he is having difficulty in paying. So, okay, you can stagger his fees to be paid. I think this is extraordinary leadership. It is not just, okay, no, I don't bother. You have to pay my fee. I have to pay my staff to salary to the staff. These are all arguments which you can just put it, but this is not extraordinary leadership. Now, the next quality which is very, very important in extraordinary leadership is listening. Again, Dr. Kiran Bhujbendra Shah, she is a very, very, very strong listener. And today she is heading Biocon, one of the largest pharma companies in the country, which is involved in biological drugs and biologicals. And she is a unique personality by herself. And she says that, it's a quote, of course, she says, knowledge speaks, but wisdom listens. So just you can go on, you can have extraordinary knowledge with you and you can keep talking about it, that's fine. But what is the wisdom is you are listening to people. Listen to people around you. Listen to what is the society telling. Listen to what your faculty is telling. Listen to the students, what they are telling. And then only you will be able to do it. I have this problem. Today I get hundreds of mails from different students. I sometimes am very harsh with them. Sometimes I advise them. Sometimes I guide them. Because the students get distracted or guided or misguided because they feel this is an easy way to go out, so let's do like this. So then I have to sensitize them, telling them that no, don't do this, this is wrong for you and it may affect you. What is going to happen? You wait for another 1 month. The world is not going to come to an end. So let us see how we can help you. Then they become reassured and they go back and they say, sorry sir, we did a wrong decision. We were there. So I think it is very important to listen to people and not react and then just give them advice and the right thing to move forward. And listen to people and try to see how you can do better. Like you may want to give an advice, but if the person is not ready to listen, what is the use or what is the situation you are going to look at? Is going to be a challenge for you. So first listen. In the times of corona pandemic we are living in today, the only way you can make sense is what to do and how to negotiate this tough time is by listening to people who have gone through challenges themselves. Every person who has gone through a challenge has got what you call as the situation where he has got some experience. So he may share with you. Like every day I listen to my hospital director for 10 minutes. I ask him, how did you manage the situation today? He will tell this problem came, that problem came, and this how addressed. So in my memory bank, I am trying to store how he managed a crisis in the hospital. So it's a learning experience for me. I can always apply that in another situation which I want. So it is very important to listen to people, and this may help you to move forward. And she also says this is a solidarity of people coming together. This is a collective fight against an invisible enemy. It has brought us all together. I think this is going to bring back humanity and humility to the way we go about our lives. Earlier, we were very arrogant. I am this, I am that, we used to say. But now, having realized that this is going to be a bigger challenge, we all are coming together and say, let us work together. Let all industries work together. Let all institutions work together. Let all students work together. So I think this is something we are all learning and understand that our arrogance is not going to take us anywhere. And only way is to be thankful to God that how He has supported us to stay on our feet still and move forward. Now, the next is, the point is act confidently. Again, this is a example not of very, very great people like what all I may told you. You may say, sir, Zydus Cadila is a big company. Bharat Biotech is a big company. Kiran Majumdar Shah is a big company. So they all were very successful. They are all true. You are giving examples of such great people. They have got 30 years of life and 40 years of experience, and they have achieved all this. So how can we show that type of leadership? Now here you see a young lady who was just a scientist working in my lab in Pune. And what was she? She was a very confident biotechnologist, and she wanted to get into the situation where she can contribute to the nation. And what was the problem she was already facing? She was in the family way and was about to deliver a baby. And on the other side, the corona started, and the company was demanding her presence to continue the testing kit development. What happened? Immediately after her delivery, she came back to work, and in 6 weeks' time, they came out with a technology which put the country again in a situation of pride, telling that we are going to have our own testing kit. See, it is a different thing. How wide and how strong or how it is going to be supportive is entirely a different thing. But putting a country in the threshold with our capability where we can deliver things is something very important. And that's what happened. So we were all very proud. All it would have been for her to say is that, oh, I have just come out of this thing. I am eligible for maternity leave for 3 months. So I cannot come to the company. It would have been a very simple answer for her. And the company by law would have to pay her salary or whatever it is for 6 months. And in this maternity leave, she could have been happily staying at home. But no, she preferred to move forward, come to the company and work for the company, and made history for herself, for the organization and the country. I think this is again a very confident person. An act of confidence is very, very important. Because if you are not confident of what you want to do, then how you are going to be managed in life? You can always keep telling, who will take care of my child? Who will take care of my family? Who will take care of this? These are challenges which are there. Then we have to work out. If you are a leader and if you want to be an extraordinary leader, you should plan all these things before that. Okay, I am going to take a big risk. Now, before I take the big risk, how I am going to safeguard the interest of all those who are dependent on me? And then take that risk and move forward. Maybe they come dependent may not be only your family. Dependent may be your employees. Dependent may be your own fraternity. Dependent may be your colleagues. Dependent may be the other sister organizations. Whatever step you may take may affect the other organizations. So I think these are something which you have to keep in mind. And the extraordinary leader always acts confidently. He is not worried about the outcome, but he acts. And I think this is what will lead to the success story. Now, another thing which you have to understand is this is not about persons, it's about the team. That always extraordinary leaders are always disciplined. They particularly follow a path, they obey. They try to build a team around them which is disciplined and moving forward. You all have heard of this Kerala boat races. You can see here in this Kerala boat race, there is a person here standing on top. His hand movement and his voice is the direction for all these people to act as a team. Now, if these people do not listen to him, The boat which has to move in forward and achieve a particular split second timing of winning will be lost, and it may even topple down. So there is one man at the leadership here on top who is giving all the directions that you should do this, you should do that, and the signal passes down. They say put the oar forward, put the oar backward, put the oar sideways, stop the oar on the left side, start on the right side, and that is how they keep moving. And this team is working as one. And even if one person misses that pushing the oar once, telling that I am very tired, I can't do it, then you lose the whole race. People know that winning this race is everything for them. So same way, extraordinary leaders, when they take up, they know they have to win the race. So with such people who are there, they build a very good team. And they are disciplined, and they expect their team to be disciplined. So they do not go without preparation. They always have a preparation in plan. They are not arrogant. They try to be very, very humble, and they try to be a part of the team. And involved in the working. They realize that because they are living in an unforgiving world. When we talk of unforgiving world, till you are successful, everybody will say, "Oh, you are great. You are a great leader. You achieved this. You are that." But one failure is enough for pushing you down. And only one way to survive and get out is the discipline. You follow the process which is required for you to achieve, and you will definitely be successful. There may be delay, but success is not going to evade you. I think this is very important in that. Lastly, I just want to quote, gravity is unforgiving. Why I say is, when you throw something from top to the bottom, the gravity always pulls you down. So it never says, "Oh, this is a lighter object, let it be there in the air for some time." No, the gravity always pulls you down. I think that is something which you have to understand, that it doesn't care, gravity doesn't care. So when you fall, nobody is going to tell that he is a great leader, so don't talk about him. No, it is the gravity, like gravity pulls you down, failure is going to pull you down. So you have to be so good that even if the failure is there, extraordinary leaders, they should still be able to sustain that and be valued for what they have taken. I think this is something, and that will happen only when you are disciplined, and this is what I would like to emphasize. The last one is, every extraordinary leader always talks about the team first. He does not talk about himself. Quite often we find leaders talking about themselves. "Oh, I did this, but for my guidance, this would have not happened. But for my this would have not happened." I think such people are not leaders. They pretend to be managers, or they are trying to be there. Always the leaders, or the extraordinary leaders for that matter, they will say, "No, my team did this, and team is responsible for everything. I have got nothing to do." In fact, the greatest leadership of the quality which we keep remembering quite often and keep speaking about is Dr. Abdul Kalam. How he led various great teams, and he always put the team first and took all the blame responsibility on him. But whenever there was success, he always gave the credit to the team. I think this is very, very important to understand. See, in the healthcare team, which we are facing the crisis of corona, there are all people who are working. There is a doctor, there is a nurse, there is a technician who is taking the swab, there is a sweeper who is cleaning all this material, there is a person who is disposing all this infected PPEs which may be there. All these people are playing different roles, and they all are part of the same team. They all, once they wear a PPE, you cannot make a difference whether he is a doctor or a nurse or a technician. They all are doing the same job of two things: one, save the patient and prevent themselves from getting infected, so that they cannot they do not go and infect others who may meet them again. So I think this becomes a very, very important role for the health team. So the team always realizes that, in helping each other, they are going to help themselves, they are going to help the society. So the team is very, very important, not the individual. So I think this is something which you all have to understand, that understand your role as a contributing to the greater good, share credits, contribute as a problem solver, build only positivity. Because I told you, there are a lot of people who will come and tell you, "Oh, the world is ending, economy is going to go down, this is going to happen, that is going to happen." I think this is something which you should let go and try to look at how we can do it. And lastly, as I said, no one individual is above the team. So when a leader is there, extraordinary leader is there, he would like to see that the team is more important. Anybody misbehaving the team, the first way is to get him out of the board. With this, I would like to thank you for giving me an opportunity. And I would like to say a leader always takes his team together and makes them look at what he is like to say, what he would like to say them. And with all the qualities which I described, he tries to become an extraordinary leader. And in these extraordinary times, we need more and more people like that. I thank you all for the patient hearing you have been listening. Thank you very much.
Thank you so much, sir, for your inspiring talk. Sir, it was our proud privilege to have such a visionary leader to enlighten on the ways and means of becoming an extraordinary leader. Sir, through the case presentations, you have taken us through thought-provoking lessons during this pandemic. We have learned that how to be an optimistic leader, yet a pragmatic leader, how to lead by example, how to become a more effective leader.
Suresh sir has left, I think.
Yes, control
Please call
L.
him.
Press Control L.
Sir?
Suresh sir has left. Please call him. I think he disconnected.
Pancha madam, press Control L.
Yes, he's back.
We will
He's back.
begin in 3 minutes.
Sorry, I lost you for a moment because I think I touched the wrong key or something. Okay.
It's okay, sir. Sir,
Yeah.
thank you so much, sir, for your inspiring talk. It was our proud privilege to have you, such a visionary leader, to enlighten on the ways and means of becoming an extraordinary leader. Through your case presentation, sir, the learnings from the thought-provoking talk are summarized. How to be an optimistic yet a pragmatic leader, how to lead by example, how to become a more effective leader in the midst of chaos, how to keep your team motivated and energized, how to communicate transparently in sensitive times. I am sure we are all inspired by your talk, sir. Now the session is open for question and answers. I request all the participants to please go to the box and ask the questions. Sir, I have one question which has popped up. By
Okay,
Dr.
before you ask question, I have one question for sir.
Yeah. Yes, sir.
Sir, this is Dr. Devanshu Patel.
Yes.
Sir, during this pandemic, the main challenge for higher education institutions, especially technical education, has been how to impart practical education and hands-on skills to the students. Now, during this period, what I have learned is MHRD has come up with a very wonderful initiative in engineering with a mode of virtual labs. So some of the engineering practicals could be conducted with the help of these virtual labs. So my suggestion was that at council level, if we could take up such an initiative, whereby we develop certain means by which the practical education, which is not possible through online mode currently, can be given in certain ways. So this was one of my suggestions. And I also look forward for some inputs from you that during this time, what things teachers can do to ensure greater engagement of the students in online education, because the main disadvantage in online education is the monotony basically, and over a period of time students get into boredom. To have their attention and to create excitement in the class is a big challenge, and how to ensure a social engagement also, because this is one thing which is greatly missing during this time. So I think if you can enlighten on these three issues, I think many teachers and policymakers will have a great input to work upon in time to come, sir.
Thank you, Dr. Devanshu Patel. First, regarding the virtual labs, we can create such virtual labs, but the same question was asked to me in one of our meetings in our university. So I asked my colleagues, what is this practical we are talking about? It is the practical means, it is the idea of a theory which you have understood. You are trying to exercise that and trying to see how the outcome is coming out of it. To understand the theory, you are carrying out a practical. It is not that practical is independent of the theory. So it is not something entirely different. So, okay, you talked about acid-base reaction. you are actually carrying out an acid-based practical exercise and try to understand it. That is fine. But there are things which we can still try to explain to them in the manner to understand how the actual practical is there. By virtual labs may be one of the things. And always this can be followed up with immersions in practicals afterwards. So what I suggest is, use the time optimally in the present stage to deliver the theory to the extent that is possible. Keep engaging the students with the practicals, which maybe they can implement it later on when they come in physical. Because when the time going to come, there is going to be a limited window when they all will have to do and focus on that. So you are ready, very clear what type of practicals you want to carry forward. We can always work on the virtual labs. That is not a problem. The second is when we talk of engagement of students, the teachers also need specific training. That's very important. See, handling a classroom situation in theory and handling a virtual meeting. Let us say, if I am going to speak to you, and I have been speaking now almost every week, I have been speaking. If I am not going to engage people in a platform like this, I don't think anybody is going to listen to my talk. If I bring the same old 10 slides and talk to them every day in every meeting, oh, they say, I have seen this already, what's there? In that, when they look, there is something new which you want to do. For example, I had to talk with the University of Kashmir. So I knew there were a lot of viewers who were there going to see from the other part of Kashmir, other than Kashmir. So while talking about pharmacy education, I gave them a tour of Kashmir itself. So they all became excited about seeing what is there in Kashmir, and everything I was correlating to them with food and the carpet and the culture. Then people were started realizing they enjoyed the talk. So I think there is an innovation required by teachers to interact with the students and build that interest. The students should come back to the class thinking, what new thing is this teacher going to teach today? So I think then that excitement comes. Engagement itself is a very big skill. Now teachers will have to equip themselves and move forward. I think there's no other simple solution for that. Now building social connectivity with students, I think it is not only about education. We have to carry out some of the other exercises that may be there. You can conduct an online singing competition for them. Students still connect with that. We do that. And there may be an online, a debate that students can participate on an issue. What they are missing in the classroom can be given online. Okay, you can tell today is going to be a food festival. So all of you bring your food and let us share and eat. So everybody will prepare their food. The students, they will tell, I am going to eat this today, I am going to eat this today. So they all get on board, and that becomes the feeling that I am not missing what, though it is not like real, but we are maintaining that bond and connectivity which is required. I think these are all innovative things. Slowly, every individual will have to develop, adapt, and bring it and make it engage themselves. I think these are some of the things to move forward. But what I would like to tell people is to remove from your mindset that the world is going to continue like this. No, it is there. It's a passing phase. It will be over. So let's not worry about how things will happen. It is going to be there. We will try to move on and we'll get back to our normal life in coming days, but it will be a little different. So we'll be very careful. We'll be very cautious. Like what happened in international travel after a particular incident, there was a lot of procedure. We went through those procedures and now it's a part of our life. We are not complaining about security processes and other things because we know it is for our own safety. I think that's what is going to happen here.
Yeah. Thank you, sir. Thank you for the answer, sir.
Sir, there is one question from Dr. Arshna Navle.
Yeah, this.
She says that, sir, as you have talked about the features of extraordinary leadership, one of the character is to put the team first. At these challenging times, when there are a lot of uncertainties, how to maintain the spirit of the team?
See, the team comes by personal bonding. You know, how much as a leader you are able to connect with the people. I was reading there that, there is what we call as a ABC, they call it. One is, in that A is, I think it is about aspirations and other things to build in the team. B is regarding bonding. How do we bond with people? And C is again next to communication and trying to be in touch. So I think the team will feel comfortable with you when you talk. When I talk of team first, is that how much are you interested about the welfare of your team? Let us say if I am in a hospital and doctors come back to me telling that, sir, there is a risk of corona infection. We do not want to work with this situation, this, that. If I tell them, no, you are all doctors, you are expected to do this, then he will say, okay, just because I am doctor, why should I do this? Why can't you come and do it? That's the question. The same thing is, yes, we know it's a challenge, but we are there to ensure you are going to safeguard your interest. What you tell me, what facility you need. We know they'll say, no, we have a stress burnout. We would like to work on alternate day. Okay, we'll work the mechanism. How do we do it? I think it is very important to make the person in the team feel that you are caring for them. And I think this is how the team spirit will build across with you.
Thank you, sir. So there's another question by Dr. Ishan. He says the industry leaders have contributed very well in healthcare, as discussed by you. How they are going to collaborate with academic institutions for betterment of health sciences?
See, industries will collaborate with you. We had a session with the industry itself in this area some time back. I had a very great meeting with them. See, industry is always looking for opportunities with academia, but what are we going to give them is something also we have to understand. So it may need not be only research and new products. What else can you give them? Can you give quality students to them? They'll come to you. Will you provide training to their technical staff who may be joining fresh? So they'll come to you. So what value addition you are going to give to them is also something. Or if you say, no, I want you to do philanthropic activity, come and help and train the thing, they'll say, okay, they are ready to do that also. They'll send 2 of their teachers to come and teach to you. Provided you are able to use to them, that same person should not go and say, sir, I went there to the institution you sent me, but not even 10 students were present there. So why should I waste my time traveling to that institution and giving them that lecture? So again, it's a question of what value proposition you are giving. Industry is always ready to cooperate. In fact, I had a meeting with Mr. Satish Reddy and the team. They are ready to take all our BPharm students as apprentices. But how many of them are ready to go and work as apprentices? They all want to become officers straight away. They say, let them come as apprentices, let them work for 3 months, and then we will see how they perform and we will try to take them and absorb them into the system. So I think this is something, it comes with, again, by personal relationship. I feel an institution which is desiring to have a very close interaction with the industry should first win the confidence of the industry. And don't look always for big industries that they should be there. There may be industry around you, the region. You have to connect with them and tell them, how do I work? I think people will always find ways to reach you.
Nice, sir. Thank you so much. So another question from Dr. Madhavi Patel. She says the time has totally changed the pattern of study for students and style of teaching for teachers. In such scenario, it is difficult to maintain motivation of teachers and learners. What do you suggest, sir, for maintaining their enthusiasm?
See, there are, as I said, to motivate them and maintain the enthusiasm is always a challenge, because the need for different people is different. Some people may look at the issues which are personal to them and try not to be motivated. The students may be feeling that, okay, what is there? There's no great learning coming to me from this system. I can as well go and read in the slide share. So many information is there. So why should I bother about it like that? So there are different perceptions about that. But basically, what I would like to tell to the teachers in this moment is like, I feel that we should look beyond our present challenge and look that students are our primary stakeholders and their welfare is utmost for us. Of course, there will be in every system, there may be a few people who are not interested, but let us worry about those who are interested and guide them and take them forward. Regarding students, I would like to tell them, see, there is a world is, as I said, is unforgiving. If you are not going to learn now, I don't think you are going to have time to learn afterwards. You may say, I may go out and learn, or I can do whatever I can go out afterwards and do it. It may not happen. And ultimately, you will lose that opportunity which was available to you. These 3 months, 4 months, it should have been a thing for you to add further the skills which you don't have. You should try to gain additional skills because jobs are going to be tougher. It's not going to be easy. And students need to get these skills. Maybe it may be even learning a Chinese language. You should try to learn Chinese language. You should try to learn German language because the jobs may be on different platforms which the world is going to change. And if you have the time, why not learn something which is going to help you in future?
Right, sir. Thank you so much, sir. Another question from Dr. Pushpalata Avasti. She says, sir, the present scenario is infested with insecure leaders, be it politics, workplace, education, in every sphere of life. How does a leader overcome such a feeling?
See, these two are contradicting words, insecure and leader. So a leader can never be insecure. A leader is always a leader. He may have anxiety or he may have apprehension about success of what he wants to do, but he will never feel insecure. Insecurity means something he is afraid of his own position or his own sustenance or his own livelihood or his own life. So such thing is known as insecurity. So such people are not called leaders. They are insecure people. Okay, they are not leaders then. A leader has to have these challenges are there. Not that I am free of challenges myself. If I consider myself even as a leader, I have my own challenges for me. But now I cannot say that because of these challenges, I am not going to do this. So I have to see how I address my challenges which are required. But for those people who are looking up to me for leadership, I should only be able to provide the leadership that is required. Or share them the challenges. Like, I can tell there is an organization or company. There may be a CEO of the company. He may say that, no, see, our company is going bankrupt. There is one way for us to work now. Now, let us all increase our productivity. We have to come with some innovation. We have to give a little bit of overtime. Maybe we'll have to work 2 hours extra. And if we increase these production margins and all this much, we may be able to manage. Maybe we'll have to take 20% less of our salary, including me. We'll lose our salary, we'll reduce our salaries. But I can manage and take us out of this situation. So I want your cooperation. So he shares his anxiety to the team, his people, and tell them, let us all work together and do it. So that is the engagement. And I don't think that is a lack of leadership or insecurity. It is bringing the facts to the table, being transparent, as you mentioned. Try to tell them the real situation and try to tell them. Like, I may have a challenge in my institution. I will tell them, look, guys, now we have been giving you good pay. But for me to continue to giving the good pay, we have to attract students coming here. How do we attract students coming here? Is how we are going to assure the incoming students, irrespective of whatever disruption in our university or in our college, classes will go on. We have got technology, we have got good teachers. Then the students will be able to come to us. Let us do it. I think this is the way we have to build the team and move forward and do it. I think it's very important.
Thank you so much. So another question from Dr. Manoj Charde. He says, why should the council not come out and prepare an app which may be helpful to all the teachers and students? This will be a uniqueness of the situation that we are going through.
See, I think one thing I will tell you, the major weakness of our system is we always expect somebody else to do something for us. I am not blaming Manoj Charde for that. I'm just trying to tell it's a good suggestion, fine. But if the app is required and the society is there, which is going to help, so I think all you have to do is to share with an IT company. If you do this, we are all ready to participate and it will be valuable to us. This is how you can use this platform. You can get advertisements on this portal and you can do like this and you can make more money out of it. So I think some guy would always be interested to do that for you. So it need not be again a national platform or a national thing which can be done. The council is looking at strengthening its own digital base. Yes, we will be doing it. We may be creating platforms where certain digital content can be available to the students. But when we talk of app and doing things relating to what all you can do. You can go on telling, I'm going to monitor the attendance with the app. I'm going to monitor the classroom with the app. I can do so many things. You can go on talking, but that is not the whole concept of council's way. Is like, like I said, more than regulating, we would like to empower and make you responsible for what you do.
Correct. Yes. So there is a suggestion from one of the pharmacologists. She says, why can't we have virtual practicals that can be prepared in collaboration with selected faculty of pharmacology throughout India? And these virtual practicals can be circulated to all the pharmacy colleges in the country for online teaching.
I mean, as you are aware the way yourself, there are already such practical softwares available commercially. So we don't have to reinvent a wheel, which is already software tested and it is available to them. One of them was developed even by JIPMER long back, some of these practicals, and they were available even about 10 years ago. So when the simulation in pharmacology experiments came, in fact, that is being used by us in the medical college. All the simulation experiments only are being used in our medical college. Only in the MPharm level, we use the real animals to do it. Simulation exercises are already existing. Yeah, we can get the pharmacologists to demonstrate some of the simulation exercises live and make a video recording. It can be done for the purpose of understanding what this really means. Instead of killing each time an animal, if once recorded and seen, they see the responses that may happen. It may be valuable. We can do that, yes.
Thank you so much, sir. So with no other questions, sir, I once again thank you for your valuable time and hope to have more chances to interact with you in the future too. Thank you so much, sir. Thank you all.
Abhay. Thank you, Abhay, and thanks to Parul University. I wish the university all the very best. Keep doing the good work you're doing, and see you soon in some other platform. Okay. Thank you. And thanks to all the viewers for coming in and leaving whatever comments you have done. My ambition or my aspiration at this moment is to remain connected with you all. So for the, in spite of repetitiveness in my thoughts, which I am trying to share on these platforms, is more the feeling that I am connected with you and trying to share my thoughts gives me the pleasure. So that's why I continue to accept such assignments, and see you soon in some other platform. Thank you very much. Thank you.
Thank you, sir. Thank you.